Dear colleagues and friends, first of all, thank you for your passion and commitment and giving in this time of crisis. I'm Fan Pate. I'm the Chief Medical Officer at the American Academy of Pediatrics. And it is my distinct privilege to work with you as you continue to make a difference in the lives of children and families and communities and our colleagues and friends too. This brief webinar speaks to connections and wellness, even more important now, and obviously more difficult. The AAP Board of Directors established a wellness advisory group prior to COVID-19. Today, you will hear from two of the leaders of this wellness advisory group. It's Dr. Jan Serwent and Dr. Jim Duffy. I'll turn the time over right now to Dr. Serwent. Jan.
Hello, everyone. While it's a privilege to be able to be with you through the webinar, I want to mention that striving to be resilient and enhancing my well-being has been a lifelong journey for me. I too struggle with all of the issues we'll speak of today in maintaining resilience in stressful times. I will be sharing information from strategies I've been taught by others and that I've read about. And it is in sharing our stories and in sharing our struggles that we can gain strength from each other. I'd like to acknowledge these materials that I've used from the following websites: the Trauma Resource Institute, the AAP Resilience in the Face of Grief and Loss curriculum, and the Johns Hopkins Resilience in Stressful Events program. As you know, we are in the midst of an unprecedented event, and physicians and healthcare providers are at the forefront. However, during any crisis, it is sometimes helpful to remember some foundational principles of our profession and why we do this work. Helping others is a motivating force for many in healthcare, and with that includes bearing witness to and alleviating suffering in others. In fact, did you know that the word patient comes from the Latin word patiens, which means to suffer? So every patient with whom we interact is suffering in some way. And the word compassion is derived from the Latin word to suffer with. With the current events, many patients and families we serve are suffering simultaneously and suffering in tremendous ways. In addition, we are all suffering due to wanting to do the right thing and help others, which brings meaning to our work, yet feeling fear about becoming infected ourselves, infecting our families, angst about working conditions and having enough supplies and personal protective equipment, worry about financial ramifications to our practices, and perhaps financial concerns of family members, the moral distress of who is able to access healthcare, and our own struggles of balancing self-sacrifice with self-preservation. And all of these worries will be exacerbated by being overworked and the exhaustion we are experiencing. Hence, building our resilience and developing strategies to maintain our well-being is more important than ever. Resilience means responding to stress in a healthy way and surviving in the face of adversity. As this figure demonstrates, in more typical times, we strive to maintain in what we call our resilience zone. We will inevitably experience some sort of stress where we charge up with adrenaline, we hopefully overcome the challenge, and then release the stress. That release may come naturally to some, to others it may be through learned or practiced well-being strategies. This cycle allows us to reset our nervous system to balance and maintain ourselves in the resilience zone. And when we are in our resilience zone, we are often our best selves. However, where we are now with this crisis and being bombarded by almost constant stressors, we don't always have time to rebound. Hence, we may be in more constant states of adrenaline rushes with hyperarousal, resulting in hyperactivity, mania, anxiety, panic, or even rage. Or we may be in the hypoarousal states, leading to depression, disconnection, exhaustion, fatigue, and numbness. Hence, while it is always important to develop some well-being strategies, it is imperative now since there are so many traumas or stressors that are taking place. A book that has had a tremendous impact on me is Man's Search for Meaning by Viktor Frankl. The author, Dr. Frankl, was a neurologist and psychiatrist who was well known as a Holocaust survivor. A quote from his book really resonates with me. "Forces beyond your control can take away everything you possess except one thing, the freedom to choose how you will respond to the situation. He goes on to emphasize how we have a choice in all of our actions, how we all experience suffering. It is part of our role in humanity, and that our lives seem most fulfilling when we have meaning. So what are the choices we have to develop our well-being strategies and navigate through stressful events? My focus is on supporting others and supporting ourselves to create a culture of caring. The first one is show up and be present. And this means both physically and mentally. Be accountable for your responsibilities, focus on where you are, and be emotionally present. That is really the definition of mindfulness, to stay in the present. Another is to stay calm, to listen generously, but avoid fixing. Sometimes colleagues just need to be heard. Understand that everyone must deal with this crisis in the best ways they can, so acknowledge that they may do it differently than you and accept that. To empathize, and perhaps activate a debrief to facilitate discussion of emotionally difficult situations. You may know that the debriefing principle comes from the military, that after battle, they review both the intellectual decision-making and also the emotional impact. By debriefing, I'm referring more to the emotional impact. It may be with 2 people or many people, but a forum to be heard and express your feelings. This allows participants to work together after a challenging event to identify, reflect, share perspectives, provide support, and decrease preoccupation with the event in a psychologically safe space. While many effective debriefings follow emotionally challenging situations, perhaps we should also conduct some virtual group forums to celebrate happy outcomes, like the patient who unexpectedly improves and goes home, to acknowledge the wonderful things that happen every day. Reaching out to others to formulate mutual support plans, both logistically and emotionally. And finally, allowing others to help you, sharing your vulnerabilities and sharing and developing your own self-compassion. Finding humor in situations is important. I have seen more toilet paper jokes and cute dog and cat videos that will last a lifetime, but I am so grateful for them that they allow me time to smile and laugh. Another option that our medical assistants in our practice have implemented is having a riddle or joke of the day at work to be posted on a whiteboard. It allows us to all talk and puzzle over the answer and then laugh when we see the answer the next day. You probably are already doing this, but connecting with others by video chats, phone, email, or letters, finding something positive or inspirational to share, advocating for your needs and those of your community, volunteer in helping others, and provide appreciation and gratitude to anyone with whom you have contact. This means a lot to people. Dr. Rachel Remen has suggested a gratitude journal with the following questions. What surprised me today? What touched my heart today? What inspired me today? While you can do this as a solo activity, I have known many who have incorporated these questions into what they discuss with family members at dinner or with their teams at work. During this crisis, I have had gratitude for the countless examples of random kindness and the best of humanity. I become a bit teary-eyed when I check out in the grocery store line, as I realize here is an individual who is on the front line, never took an oath like me or us, but is doing just what they need to do to help others and allow me to feed my family. So with this time, you may want to commit to your own individual well-being plan. You can do this silently or write it down. Behavioral psychologists have found that we are more likely to stick to a plan if we write it down or share our intent with others. You may want to go to the AAP Resilience in the Face of Grief and Loss curriculum for an example of an individual well-being plan. In closing, I would like to extend my heartfelt gratitude to all frontline providers. Thank you for helping us to stay safe and healthy. And I'd like to end with this quote by Marianne Radmacher. Courage does not always roar. Sometimes courage is the quiet voice at the end of the day saying, I will try again tomorrow. Thank you so much.
I've had many of the same feelings as in the checkout line at the grocery store. So I thank you for sharing those thoughts. And I'm certain that other people will identify with them very deeply. Staying connected in times of community trauma may be life-saving. Physical distancing is absolutely necessary from a public health perspective to limit the spread of the virus. However, social connectedness may be a protective factor, particularly for those who are isolated, physically, emotionally, or both. During this time of crisis, social connectedness may have both short and long-term benefits by limiting the effects of traumatic stress. Staying connected can be conceptualized on at least 3 levels: connecting with your mind-body, and I'll explain that, connecting with others, and connecting with the common good. All contribute to health and give meaning to your activities. Connecting with your mind-body. Some comments that I've heard recently from healthcare workers caring for patients on the front lines in the emergency departments and the ICUs are comments like, "I feel weird, like not myself," or "I wake up in the morning and think, how can this be real?" These experiences are described as mild dissociative events, derealization and depersonalization. These aren't pathology, but these dissociative events, when severe, are linked to post-trauma symptoms and may contribute to post-traumatic stress disorders, substance abuse, or depression. During other mass casualty events, this spectrum of symptoms has been known as psychic numbing, a process that may limit feelings of compassion and limit willingness to help. Many people use aerobic exercise to resist the mind-body separation. The endorphin rush that we're familiar with and physical fatigue can help with mood stability and sleep onset. Also useful are techniques drawn from trauma-focused therapies, including somatic quieting, focused breathing, and mindful movements, such as walking meditation, yoga, or Tai Chi. These are all techniques that are taught children who are in trauma-focused cognitive behavioral therapy. We can learn them too, and we can pass them along to children if they present to our office with anxiety disorders. Anyone, even during a crisis, can do a quick self-check on respiratory rate, heart rate, or areas of bodily tension, and this is known as a brief body scan. The effect is somatic quieting through calming the sympathetic nervous system. A few deep breaths with prolonged expiratory phase can help create a sense of calm or even equanimity during a quick action. I've often used a series of 3 breaths and count 4 on the inhalation, hold the breath for about a count of 6, and then exhale for about a count of 8, and do that 3 times. Headspace is an app to aid with formal meditation, sleep onset, and mindful movements. The company is offering a free subscription to healthcare workers during the pandemic, and you see the link that's on the slide. Another resource, of course, is a 4 CD set of the guided mindfulness meditation series from the mindfulness-based stress reduction program from Jon Kabat-Zinn. It's very important to find your supportive community. Many healthcare workers are feeling alone and isolated right now and need emotional support in addition to the obvious need for PPE and clinical guidance. Questions include, what are you doing to find your supportive community? Do you mostly find support with intimate family, a circle of friends, an online group, or other format? How do you help or guide the members of your treatment team to be supportive of each other? Many organizations, including the AAT and the APA, are offering chat rooms, daily conference calls, and online forums to link healthcare workers with each other and promote peer support, both to share clinical strategies and to reduce feelings of isolation. Once you find your supportive community, it might be useful to think about how to best give and receive support. Arthur Kleinman, a psychiatrist and medical anthropologist, at the time of his retirement, wrote an essay entitled Presence for The Lancet. In it, he described presence as, quote, a calling forward or a stepping toward the other. It is active, It is looking into someone's eyes, placing your hand in solidarity on their arm, speaking to them directly and with authentic feeling, end quote. Being present when you connect with others involves both listening deeply and speaking honestly from the heart. We medical people are primarily concerned with acting in some way to relieve suffering. We may forget that simply being with, authentically and lovingly present, being with a person experiencing trauma may be life-saving and the most important action that we could take at that specific time. If you are in a position of leadership, you may find it important to schedule regular private conversations with team members. Some questions to ask may be, do you have everything you need to be safe? Do you have a strategy to protect your family? What concerns you the most? Or just generally, how are you holding up? You needn't have answers for all these questions, but you will have made a connection and you will have strengthened the mutual emotional support of the team. In a group setting, perhaps during the huddle at the beginning of a shift or session, it is even possible to have a minute or so of centering silence to build compassion and a sense of mutual support. Connecting with the common good. Public health specialists imply that some cultural habits may have to change, including shaking hands as a greeting. Bumping elbows seems to me to be a humorous but not enduring alternative. A simple hand over the heart, or better yet, forming a prayer position in front of the heart with your hands, common in Hindu or Buddhist cultures, may be better choices. On the surface, the greeting is a sign of humility, as I bow to you. More profoundly, the greeting means the most sacred part of me bows to the most sacred part of you. Now that's very close to the idea in many faith traditions that we are united as humans by a measure of the divine in each of us. As we embrace suffering by being fully present, mind and body, for the benefit of others, we also recognize our global solidarity and engage in our work to benefit the common good. Dr. Rudolf Virchow in the 19th century and later Sir William Osler, among others, taught a one medicine concept, realizing that veterinary and human medicine are inseparable. The SARS epidemics are testimony of the correctness of this perspective, but we may go further. One medicine also means that we are connected globally in an ecosystem that is changing, in part because of our lifestyle choices. Perhaps one of the outcomes of the current pandemic will be a redoubled advocacy for addressing other global problems such as climate change, food maldistribution, water conservation, and resource inequalities, as well as health disparities. Physical distancing, yes, but also global solidarity. Cultivate compassion with those that suffer, connect with those isolated, commune with those who are hungry, conspire with those having trouble breathing. Remember to exhale. Stay in the present moment. The meditation teacher Tara Branch relates a teaching story from the Vietnamese Buddhist monk Thich Nhat Hanh. The story portrays the same sense of emotional balance that Dr. Osler described in his famous address, Equanimitas, to young doctors in 1889. When the crowded Vietnamese refugee boats met with storms or pirates, if everyone panicked, all would be lost. But even if one person on the boat remained calm and centered, it was enough. It showed the way for everyone to survive. In the midst of COVID-19 panic, would that each of us be that person with equanimity, showing the way to survival. Thank you.
Thank you very much. Thank you, Jan. Thank you, Jim, for thoughtful, meaningful, and useful information. Please know that this is the beginning of the intense discussions with respect to wellness and connections. We particularly ask you to take the time on COVID-19 at the Academy. There are discussion boards there. There's one on connections and wellness. Please use that discussion board to direct thoughts and comments and questions to others. We ask you to go on and to give support there, but also to give ideas about what you're doing in this time of crisis. And know that additional questions regarding COVID-19 writ large can be answered and directed at covid19@aap.org. Thank you so much.